Medicare Supplement Plans, the plans that are designed to fill in the major gaps left by original Medicare, and what some would say are the perfect complement to original Medicare. But are they? Let's go over everything that you need to know about Medicare Supplement Plans. Now, you may hear several different names that are referring to these plans, but they're all the same. So whether you hear Medicare Supplement Plan, Medicare Supplemental Plan, or Medigap Plan, they're all the same thing, and they're referring to the same thing. And we're going to go over both the pros and the cons of Medicare Supplement Plans, but make sure you watch to the end because we're going to talk about who, in our experience, tends to lean towards Medicare Supplement Plans and which types of people tend to lean away from Medicare Supplement Plans. But before we get into the pros and cons, it's important to understand where Medicare Supplement Plans fit and what they are trying to accomplish. Now remember that original Medicare, Medicare Part A and Medicare Part B, is provided and administered by the federal government. What this means is that if you have a bill after visiting a facility, a hospital, a provider, that bill first goes to Medicare, the federal government, CMS, and they pay that bill. And anything that they do not cover is sent to you to take care of. As we've discussed in other videos, the problem with this is that there are substantial financial gaps that original Medicare leaves that are your responsibility, and they are unlimited. And so that becomes a problem, which is where Medicare Supplement or Medigap plans come in. They come in to fill the gaps left by original Medicare Parts A and B. And we're specific on this for a very important reason that we'll get to here in a minute. Supplement plans pay secondary to Medicare. Now what that means is, as we talked about, the bill is going to go to Medicare and they're going to pay what they agree to cover. And then the private insurance companies that offer Medicare Supplement plans will cover the rest. And the reason that this is important is that if Medicare covers it, your Medicare Supplement Plan covers it. And that is a lot of peace of mind, and it's nice knowing that, look, if Medicare covers it, we're good. You don't have to worry about prior authorizations or other things that are common with things like Medicare Advantage plans, because if original Medicare covers it, your Medicare Supplement Plan covers it the same way. Here are the 10 standardized Medigap plans, and each has a letter. Now, Medicare is notorious for the alphabet soup with all these letters floating around. So you have Medicare Parts A, B, C, and D, and then you also have Medigap or Medicare Supplement Plans. And if you notice, they also go A, B, C, D, and then we're going to skip over E. Most people can't get a Plan F anymore. H, I, and J are gone, and then we're going to round it out with L, M, and N. So the plans do not get explained easily. There isn't some super simple way to remember all of them. So we're going to make a completely different video that goes over the 10 standardized plans that are available to you as Medigap or Medicare Supplement plans. But for the purposes of this video, we're going to focus on Plan G. At least with the people that we work with, they tend to pick Plan G the vast majority of the time. So we're going to use Plan G moving forward as our examples for the pros and cons of Medigap plans. I say that these plans are standard because when it comes to Medicare Supplement plans, the plans are the same no matter what insurance company you choose in terms of their coverage. And what I mean by that is a Plan G is the same with one insurance company in terms of its coverage as it is with any other insurance company. So a Plan G is the same as any other Plan G. A Plan A is the same as any other Plan A. So all of those letters are standard plans. They're going to be the same coverage no matter what insurance company you choose. Now, where they differ is in that insurance company itself, and that's going to come in the forms of premiums, it's going to come in the forms of customer service, and it's going to come in the form of how they handle claims, meaning how quickly they handle and process claims. So that helps us set the stage for exactly where Medicare Supplement plans fit, what they're trying to accomplish, and now we can move into the pros and cons of Medicare Supplement plans. The top reason why most people that we interact with choose Medicare Supplement plans has to boil down to the cost sharing. With a Medicare Supplement plan, specifically a Plan G, all you're responsible for is the Part B deductible that in 2022 is $233. That's an annual deductible. Once that deductible is met, your Medicare Supplement plan will cover 100% of the costs for any Part A or Part B expenses for the rest of that year, as long as those are approved by Medicare. The fact that you don't have cost sharing in the form of co-pays, co-insurance, anything like that, all you have is that $233 deductible. It's unbelievable coverage and gives a lot of people a lot of peace of mind when it comes to their financial costs once they move into retirement. The second major pro to Medicare Supplement plans would have to be the network. And what I mean by that is that you don't have a network when you're on a Medicare Supplement plan. Any facility or provider that participates with Medicare will take you. It doesn't matter where it is in the United States. You don't have a network of providers where you have to check to see if they're in network. If that provider or facility participates with Medicare, you're good to go. You can visit them, you're covered. Now, it's important here, there's kind of a semantics issue here of whether they participate with Medicare or whether they accept Medicare patients. And this is something you just have to watch for. If a doctor accepts Medicare patients, that doesn't necessarily mean that he or she participates with Medicare. Your providers have to accept the Medicare fee schedule and participate with Medicare, right? Because they could say, oh yeah, sure, we'll see Medicare patients, but we don't participate with Medicare. Well, then you're going to have to be dealing with excess doctor charges there, and things can get a little bit rough. So for the most part, though, it's pretty straightforward. Just make sure that your providers participate with Medicare. And if they do, you can visit them no matter where they are in the country with your Medicare Supplement plan. The third major pro with Medicare Supplement plans is their straightforward, easy to understand coverage and nature. And we touched on this before, but if Medicare covers it, your Medicare Supplement plan is going to cover it. You don't have to jump through the hoops that are common with Medicare Advantage plans of pre-authorizations, pre-certifications, is the person in network or are they not? And it makes it very easy to manage and very easy to understand. And there's just not a lot of moving parts when it comes to a Medicare Supplement plan. And what we have heard from most providers and facilities is that they prefer to work with Medicare Supplement plans because it is so straightforward and easy. So those are the major advantages of Medicare Supplement plans. So you might be thinking, how could you go wrong with this? I mean, everything sounds great. Well, let's go over the cons of Medicare Supplement plans. The biggest drawback to Medicare Supplement plans would be their cost or their monthly premiums that you are responsible to pay. So because of that great coverage in the form of cost sharing, where you really don't have a lot of cost sharing, that comes at a cost in the form of monthly premiums that you are responsible to pay. Supplement plans in our area tend to run between $120 and $200 per person per month for those who are 65 years old. And I mention that age because Medicare Supplement plan premiums are based on your age, your gender, and your geography, and finally, which insurance company you choose to go with. What this means is that with most plans, you're going to see an increase in that premium every year on your birthday. We call this tongue-in-cheek the happy birthday increase because every year on your birthday, you move into another age bracket, you move up a year, and that changes the premium amount for that supplement plan with that plan carrier. It is also common for insurance companies to give an increase to those premiums every calendar year. So what that means is that in addition to your happy birthday increase every year, you could also get another increase every single year in those premiums. So you're getting 2 increases every year on your Medicare Supplement plan premiums. So yes, it starts at $120 to $200 for a Plan G in this area, but that goes up every single year to where by the time you're in your 70s, 80s, I mean, that can be a pretty substantial number. The other thing you need to consider is that you are still going to be responsible for your Part B premium, which in 2022 starts at $170.10 per person per month. Now, most people are going to find themselves in that $170.10 per person per month range, but if you're a higher income earner, that amount only goes up as well. So now in addition to those premiums that you're paying for your supplement plan, you also still need to pay your Part B premiums, and that's going to add to your fixed costs that you're responsible for every month all throughout retirement. Another very important con when it comes to the premium discussion, the financial discussion we're having right now, is that as of right now, which is 2022, you cannot use HSA dollars to pay Medicare Supplement Plan premiums without a penalty. So you can use your HSA dollars to pay co-pays or co-insurance or deductibles, but to actually pay for these premiums, your Medicare Supplement Plan premiums, you cannot use HSA dollars without a penalty. Moving on to the next con of Medicare Supplement Plans, and that would be that there really aren't any perks. And this goes back to what I was referencing before about being very specific around what Medigap plans cover when it comes to Medicare Parts A and B and the co-pays and co-insurance that are associated with those 2 coverage levels. Now, what I mean by that is that Medicare Supplement Plans don't cover anything except the gaps that are left by Medicare Part A and Part B. So what this means is that it doesn't come included with prescription drug coverage. You have to go purchase a Part D prescription drug plan separately. And in 2022, the average cost of a Part D plan across the country right now is $33 per person per month. So tack that on to the premiums and the Part B premiums that you're already paying, and that goes to add to that cost. Supplement plans do not include things like dental or vision or hearing benefit coverage. So you would have to go purchase those separately if that is something that you would want to have. And all of those premiums start to add up. Well, now the supplement plan, you're paying higher premiums for richer coverage when it comes to Part A and Part B, but you're going to have to go find your Part D coverage, your dental, your vision, and other things. Now, there are some carriers that do offer gym membership reimbursements with their supplement plans. Not all of them, but there are some that do offer that. But again, for the most part, you're only getting that Medigap, that coverage of the gaps left by Part A and Part B when it comes to your hospital and medical coverage provided by Original Medicare. So if you take the lowest level of a Part B premium at $170.10 per month, and then you get a Medicare supplement plan at $150 per month, you throw in a prescription drug plan at $33 per month as the average. Let's say you want to add in a dental plan at $30 per month, and then a vision plan at $10 per month. Well, your monthly premiums, your fixed costs are going to come in at just under $400 per month, which in the grand scheme of things is still a really good deal when you compare it to your coverage through an employer, depending on how much your employer contributed. But still, $400 a month for insurance isn't that bad. But remember that those premiums climb sometimes twice a year, every year for as long as you live. The final con that we're going to discuss around Medicare supplement plans would be if you wanted to move Medicare supplement plans or move to a Medicare supplement plan. If you go with a Medicare Advantage plan first, it can be difficult to move to a Medicare supplement plan. Usually it's because you know that higher costs are coming, there's some sort of a high cost medical situation happening, and you would like to move from a Medicare Advantage plan to a Medicare supplement plan. If you've been on your Advantage plan for a year or more, then you are going to be medically underwritten by the insurance companies that offer Medicare supplement plans. And here's what I mean by that. Being medically underwritten means that they're going to ask you questions, medical questions. They're going to figure out what prescription drugs you're taking. They're going to figure out which procedures or surgeries you've had. And they could get some sort of a recommendation from your doctor. And after all of that information is compiled, they could say, you know what, you're higher risk. You're going to have even higher premiums. Or worst case scenario is they could say, you know what, we're not even going to accept that risk. You can't have a supplement plan. So you could be denied coverage for a supplement plan through specific carriers. But this also applies if you chose to go with a supplement plan when you first enrolled with Medicare and it was the guaranteed issue, you weren't underwritten for a Medicare supplement plan. As long as you make that decision during your initial enrollment period for a supplement plan, you're fine. Well, let's say you move down the road a few years and that insurance company that is giving you that supplement plan has started to increase their rates pretty dramatically for whatever reason. Well, for you to switch from that insurance company's supplement plan, let's just say it's a Plan G, to another insurance company's Plan G, that other insurance company could also do medical underwriting, meaning they could say, you know what? No, we don't want to cover you. You can't switch over to our supplement plan because it's less money. You have to stay with what you're on. There are some carriers that will allow you to switch from one carrier to them as long as you're going from one like plan to another like plan. So as we talked about their standardized plans, if you're going from a Plan G with one insurance company and you're switching to another insurance company's Plan G, there are some instances where those carriers will accept you without any medical underwriting questions. But in most cases, that's not going to happen. They are still going to have some sort of medical underwriting. So the point of this is that moving supplement plans isn't very easy and isn't as straightforward as it would be, as an example, to move from one Medicare Advantage plan to another. So those are the pros and cons of Medicare supplement plans. And so now we're going to move into more what types of people tend to move towards Medicare supplement plans and which types of people tend to move away from supplement plans and towards something like a Medicare Advantage plan. And there are three general topics that we're going to use for this discussion. The first is health, the second is wealth, and the third is risk tolerance. So starting with health, in general, people who are more prone to higher cost healthcare challenges are going to choose a Medicare supplement plan. As we talked about before, the premiums are higher, but they are purchasing and they are buying really, really good coverage when it comes to your cost sharing moving forward. So people that are higher utilizers of the healthcare system tend to move towards Medicare supplement plans because of the overall coverage and the peace of mind that comes with Medicare supplement plans. Moving on to wealth, it's important that you will be able to sustain and afford the supplement plans for as long as you're going to have one. So people in general who can afford the premiums of not just Part B, but also the supplement plans, the Part D prescription drug plans, and any of the other ancillary products like dental or vision that they would want, if they can afford that, you can't find better coverage once you've moved into retirement than going with Original Medicare, a supplement plan, a Part D plan, and purchasing standalone products. I mean, the coverage is just fantastic. So people who have the wealth to afford that and can plan on that for the rest of their lives with those fixed costs that are eaten up no matter whether or not they use them, that's the type of person that will gravitate towards supplement plans. Moving to the third category, which would be risk tolerance. Look, Medicare supplement plans are built for the people who want to lay their heads down at night on their pillow and they want to know, or they want to understand that they don't have to worry about their health insurance. It's all taken care of. It's straightforward. They don't have to jump through any hoops. Medicare supplement plans are perfect for this type of person. They have a very low risk tolerance. They just don't want to think about it, set it and forget it. I don't care if I'm paying premiums and will never use it. If I ever do need to use it, it's nice knowing that it's there and I won't have to think about it. That's the type of person that works really well for a Medicare supplement plan. Finally, the category here for the types of people that tend to gravitate towards supplement plans would be freedom. So the freedom category is added onto those three. I know there's four now, but freedom in the sense of they don't want to think about whether or not they're in network. If they're traveling, they don't have to think about things. They can visit any provider or facility that participates with Medicare. Again, the secondary coverage to Medicare, where they aren't going to have to jump through hoops or get pre-authorizations or prior certifications or anything like that. That freedom and peace of mind is something that people who appreciate that go with Medicare supplement plans. So who tends to avoid Medicare supplement plans? And we're going to go over those same three categories. So health, wealth, and risk tolerance. Starting with health. In general, people who are healthier and are lower utilizers of the healthcare system tend to gravitate away from supplement plans and towards Medicare Advantage plans because they don't want to pay for something that they aren't going to use. And with an Advantage plan, you won't. You aren't really paying for anything they aren't going to use. You're just going to have a higher total risk in the event that you have a really bad year. And that's really the crux of the whole insurance conversation anyway, is how much are you willing to risk towards your health? So, but in general, with this category, health, those in general who are healthier tend to gravitate more towards Advantage plans and away from supplement plans. Moving on to wealth, those who are not in a position to where they know that they will be able to afford those fixed costs of the Part B premiums and the higher cost of the Medicare supplement premiums that go up twice a year in a lot of the cases every single year, in addition to the Part D premiums and dental and vision and everything else, those who don't feel comfortable that they'll be able to afford those tend to gravitate towards Medicare Advantage plans. And again, that leads us to the risk tolerance conversation of those who are willing to take the risk of saving the money that they would have spent on premiums during the good years, setting that aside, and then having that money available for the bad years to meet their out-of-pocket maximum with an Advantage plan as an example, will gravitate towards Advantage plans rather than supplement plans. Right now in our area, Advantage plan maximum out-of-pocket costs, so the maximum that you would pay in a really bad year, sit between $4,500 a year and $7,550. So if you just take the math on that and the premiums that you're paying for Medicare supplement plans, if you set aside those amounts for 2-3 years and then you have a bad year, you'll have the funds available to pay for those out-of-pocket maximums on the Advantage plan. The problem comes when you have multiple bad years or chronic conditions that are every year for the rest of your life. That's where an Advantage plan gets a little sticky. And again, we're back to who would choose a supplement plan. It would be somebody who's having higher costs year over year, and they want the coverage of a supplement plan. There you have it. You made it through the pros and cons of Medicare supplement plans and who they work really well for and who they don't tend to work super great for. Every situation is different, and every individual has their own individual situation. So if you have questions around which is right for you, feel free to reach out to your agent or reach out to us. We're more than happy to help you. If you go on to 90daysfromretirement.com, we actually have a very quick assessment where you can pick things that are most important to you, and it will kick out a response as to which probably suits you better with an Advantage plan or a supplement plan. But again, if you have questions, don't hesitate to reach out to us. If you've made it this far, please consider subscribing to our channel and giving this video a like. We love making these videos for you, and we will continue to do so about all things related to Medicare, Social Security, estate planning, and long-term care. So again, as always, we appreciate you and thank you for watching.